Good evening guys, Saul from DSI here, alive and kicking. Today I would like to introduce the newest addition to the DSI implant line called DSI Grip. Yes, indeed, we call it Grip for the good reason. It could achieve the anchorage for the different types of bone. Some of you have already seen this implant on our website and have been asking yourself what is the thing is. Indeed, this is very special implant that stays just aside from everything most obvious. It's the first tissue level implant. Until now we had only the bone level solutions. Next, you couldn't miss very wide bone condensing threads, and of course the amount and the range of the sizes you have is enormous. From very short 8 mm to achieve the cortical anchorage, you could go up to 25 mm, which is already of course the pterygoid bone. And yes, right now we have the pterygoid implant, and I think this is the good reason to speak about this approach in this video. With the next question will be why? Why would you need to use the pterygoid? So stay with me until the end of the video. You will see all the benefits and points to consider, and I believe that in the end you will see yourself that it's a viable weapon of choice that you need to have on your side with your implant practice. So first of all, the most obvious is additional support. Additional support never means you could achieve a wider AP spread for your restorations using the pterygoid implants. You could definitely provide your patient with the more natural and of course aesthetically pleasing 14 teeth restoration instead of 10 or 12. And yes, this implant also works on very high torques, so your overall CTV torque will be higher, which is actually a good thing. And next is elimination of the cantilevers. Remove the cantilevers from your restorations. This is the wrong thing to use. You know, in Israel, when doctors that are surgeons, in most cases they work until the end, so they also made the restorations. They know how harmful it could be and they try to avoid. So this is the good way to say bye-bye to the cantilevers on your maxilla. Next but not least, of course, this is the option to use it is the rescue implant. SOS in cases when something gone wrong, in failed implant cases, in inherited cases with the patient with all the implants that you don't know how to work, with the very small and weak bone situations. You could definitely use this implant, and you will see many options to just provide the patient with the full and long-lasting restoration using the pterygoid implants. So this is not all, but I think this is the main points. And yes, it could be also considered as the alternative to the zygomatic implants. Right now, some of you will stop the video. What the hell he's speaking about? The zygomatic is canine, maybe premolar zone. Here is definitely the molar, second molar, posterior zone. It's different and it couldn't be. Yes, I agree. At the second part of this video, I will explain all the points I've mentioned to the depth. We will see the implant itself to the close-up. I will explain you some special features that the implant has. And if you stay until the end, you will see the recommended drilling protocol we've prepared. And it's made using special tools and special drills, which we engineered specifically for this implant to make the implantation as easy and as safe as it's possible. So stick with us and let's see what the DSI Grip pterygoid implant is capable of. With the new kit you have all the tools and drills. For the protocol, here we will suggest only one option that we find the most universal. Let's take a swift look on pterygomaxillar bony complex. It consists of maxillary tuberosity, type 4, very low density with fatty tissue bone. In many cases, you don't even need to drill, you could push it through with the osteotome. Then you meet the pyramidal process of the palatine bone, which is 150% denser than the maxillary tuberosity, very dense bone, and the pterygoid process, which aborts sphenoid bone to the palatine bone, also dense type 1 bone. You might want to use the pilot drill with the drill extension because they are already distal. On average, will come about 10 mm angling towards the medial plate from the distal of tuberosity. Now it's time to take the two osteotomes, insert the thin one and gently tap, listening to the change of the sound because the bone will get denser. And then you could go to next. If you feel that bone is denser than it should be, drill again, aiming medially. On this stage, you could also shape the optimal implant axis. You should be able to get this 3 mm osteotome much deeper, condensing and expanding. Now you could proceed to the implant placement or go up to the next drill, which is 3.2. For the implant you could use the manual driver and put the implant by hand, while using handpiece is fine too. For the first few times you probably would want to go with the hand driver. You will feel the bones very dense, go to the point when it's harder, turn and switch for the longer ratchet driver. Tighten and loosen it until it goes to the depth, approaches the pterygopalatine fossa, and you will feel it going into the medial plate. Correct the angulation using 45 or 52 degrees multi-units and proceed to the prosthetic stage of the surgery.
Brought to you by DSI.